And since then, right, it's come a long way because
Yeah.
that was pain treatment. He was studying it for pain and basically rejuvenation of the skin things. And now we're going way beyond that. A lot of people think laser skin, right? Anti-aging. You do laser,
Yeah.
skin treatments a lot now, but we're talking about something much, much more in depth, and you're utilizing on these
Yeah.
complex chronic diseases, on cancer. Can you talk about how a laser can effectively start to work on these types of things? Because for the skin, you could kind of understand the mitochondria stimulating a little bit in the epidermis. But when you start to go into these others, some people feel a little bit lost on how lasers would work there.
Yeah, certainly. And you and I are speaking from the United States. In the US, most of the FDA approved, light therapy of whatever type are for dermatology. There's some approved that they use in ear, nose, throat, conditions. But again, it's mucous membrane, so it's sort of external, et cetera. And then there's, research in other areas. In other countries, it's a little more broadly used, which is why not long ago, everybody would have to go to Europe or Asia to
Right.
to find anything, right? Like your dad did. Um, so the reason, so in America, North America, the doctors will say, well, I know the dermatologists do this, and I know, whatever. But they don't see this whole part in the middle, which is, photobiomodulation, where you're using the light energy wavelengths to actually activate a substance and make it work better inside your patient, for example. So there's this whole part in the middle that's much more common elsewhere in the world, most of the rest of the world. So what we do with that, in the shortest way to say it as possible, is, and this is different for each molecule, each whether it's a medication or a natural substance or whatever. Um, but the idea is that some molecules are structured in such a way that when they encounter certain light wavelengths, they actually become photoactivated. And so their their ability to essentially do what that molecule is supposed to do when it interacts with a cell, let's say, or your plasma, um, changes when you put energy into it. And this sounds like really far out and weird and all that, but actually there is a whole again, go back to like the most narrow thing, which would be FDA approved substances. There's a whole series of photobiomodulation drugs that are approved by the FDA, and they are for very specific purposes. But if you look at their structures, and then you look at other either drug or complex natural structures, like a lot of botanical isolate, you have this a real similar structure. So you can photo activate that. So it's not really that far out. It's just they're used in these tiny bands of medicine, so people don't hear about it. So that was kind of in my story. That's where I was saying, because we had access to endo laser equipment there where we could put an IV laser in and then maybe add something. Um, we started there just because that's the equipment we had. But then it was okay. And I took my old knowledge of, of wavelengths and all that and looked up, okay, these herbal isolates or these nutrients or these drugs have these wavelengths that they absorb. So let's try and give that, and then we'll have the wavelength of the laser that's in your vein be the same. Um, and by and large, that's where we started to see, all these big increases in, ability to have a substance, then be photo activated. So when it reached the target, it sort of like it works harder. You get more
Yeah.
out of it, right? Um, so, for example, back you had mentioned I was involved in some research. It was human research in advanced cancer, and my part was all of the intravenous and interventional therapies. So just like what we're talking about, this was a little bit before we had some of these cool light lasers and all that. But we found, for example, just one single thing, curcumin given intravenously, which it's not terribly stable, so it had to be prepared specifically, so don't try that at home. But if we gave the curcumin intravenously at high enough doses, sometimes we would get metastases to stop growing, which is a very hard thing to do. Now, it's sort of a limited treatment because it took a lot of time. It was extremely expensive. But people who had treatment resistant, end stage cancer, they had the time and they wanted to do it. Uh, Later, that type of curcumin became unavailable most of North America. And so then we could only get a different type. Well, you couldn't give the same doses. So what we do now, if people have it, is we give the appropriate doses that are lower, but we photobiomodulate it, and you can still get more activation of that curcumin by adding its light wavelength that it resonates with, that it absorbs. And that story could be repeated, into any number of other things that we can use it with. So it's a way to get more traction out of it. The other thing, which if I'm remembering correctly, it was maybe in one of my talks you heard, is we sometimes forget also that our blood already has a whole lot of things floating around in it. So some people say, well, why would I do endo laser and just have the blood run by the laser, at different colors? Well, it's because you have a lot of very active enzymes floating in your plasma for the most part. You have red cells and white cells, which are actually very active substances. And if you're fighting something, the white cells are even more active. And they all have a resonance as well. So sometimes we may just photoactivate your blood and your enzymes and your white blood cells. So that's kind of that's the interventional, sort of interior laser stuff. The other thing that we do a lot more now, just because, as you mentioned, the older units were a little cumbersome, kind of hard to deal with, is we know more now than we used to about, for example, near infrared light and how far it goes into the body. So it used to be thought that, you put a transcranial on like the dermatologists use, and it'll get down to the skull and bounce off. Well, now we know it actually goes through the skull and gets all the way into the tissues. Just like in physical therapy, which is not uncommon, they'll use, near infrared over a joint that's hurting, like your dad was doing. Well, it's because it's going in. Well, near red gets in a little bit and can do some work. Near infrared goes in further. And if you go like to far infrared, that's why they use that as a sauna device, because it actually heats your organs up from the inside. So we use a lot of the red light spectrum from red to near and far infrared as a topical application. And it actually, it's good for joints and muscles and, healing, but also we use it a lot when we're doing treatments that are focused on the brain, whether it's a cancer or maybe a traumatic brain injury, something like that. Very, very useful.
Yeah, those applications, one is obviously not going into the body with the transcranial photobiomodulation. It's just penetrating through with no pain, no anything, no real side effects that I know of, correct?
Yeah,
Right.
really none. Yeah, I mean,
Yeah.
any light device, if you leave it on too long or you have the power not appropriately applied, could be a
Right.
problem. But appropriately, appropriate wattage, power, and appropriate wavelength, you've got a huge margin of safety. It's just the adverse events are almost unheard of, really. Yeah.